Welcome to Dental Vibes. I'm Gabby.
And I'm Carla.
We have been dental assistants for over a decade, and we share a passion for dentistry. So in this channel, you can expect to see content for dental assistants and for anybody that wants to take care of their oral health. So if you like teeth, make sure you subscribe to our channel.
Also, if you're returning back, thank you so much for your support. Please continue to support us by liking this video and sharing it with your dental peeps. And today's topic is about how to fabricate custom whitening trays.
In today's video, we're going to show you guys how to make custom whitening trays. And it's actually going to be an interesting video because we're going to use, I would say, a defective model.
And if you guys don't know what we're talking about, go check out our video on how to poor models fail. We're going to leave the link in the description box.
So occasionally you have a situation where whatever's going on that day, your model just did not come out perfect.
Yes.
And sometimes you can still save it, especially for bleaching trays. You have room to kind of slack a little bit. So we're gonna use those messed up models and we're gonna show you guys how you can fix it up and how your bleaching trays could still come out great.
So let's just get started.
As we mentioned, we're gonna go ahead and use my models to make some bleaching trays for me because I'm way overdue. And here are the models that we took last time. Oh, disclaimer, for the infection control Karens out there, yes, I'm not wearing gloves. Yes, I'm not in scrubs because these are my models and I'm making my bleaching trays. Just wanted to let you know.
Thank you for clarifying that for my Karen friends.
So on the lower model here, we had some voids, as you could see over here. The upper model came out pretty good. There was only one little void here, so this is super easy to fix. So we can go ahead and start with that. I'm using the Liquidem. I always save the Liquidem from Zoom to do these kind of stuff. So I'm gonna come in here and just kind of fill in.
And if you don't have liquid, then maybe some expired.
Oh yeah, some expired flow. Yeah, that works. I know some people do it with wax, but honestly, I think wax, it's not manageable. It gets kind of weird to mess. Yeah, I just don't like wax. So I think that's the only one really we have to fix on the upper. So let's go ahead and work on the lower. So I'm gonna start with this one here, so I'm just gonna go ahead and fill in.
These voids on the incisal are the worst.
They really are.
And
so kind of like that.
You are saying if you have it on the incisal, it's trickier because that's where it's gonna sit over. So if you do it right, I'm sorry, if you don't do it right, overfill it or something, or it's a different shape than what the tooth actually is,
right,
it won't sit.
Tray won't sit.
It won't sit properly.
And that's why it's very important for you to try the bleaching trays in your patient's mouth before they take it home. I know sometimes offices just like hand it to them, but you never know. Sometimes it doesn't fit properly and then the patient is stuck with these trays that doesn't fit properly and they don't know any better. So I really think it's always important to make sure the patients try it in and you make sure that they fit properly.
I agree.
So here you see how it's going to get tricky because it's like right in between. So I'm going to build it up like that. And I'm going to go a little bit more.
So we're basically kind of just like filling in all these voids to make it work, because the other option is bring the patient back and take new impressions and then re-pour.
I think that would work for now. So now what I'm going to do is start making what I call is room for the gel to sit on your bleaching trays. And I know everybody does differently. Some people don't do this step. I personally like to do it just to make sure that once the patient puts the trays in, that the gel is not going to leak to the gums. So I always tell patients, you don't worry about the molars. You're always going to bleach just premolar to premolar because that's what you show. So I'm going to start on my premolar.
I agree with this. I know people that don't do it, but I do like it. You had a fancy name for it. I would call it a reservoir.
Ew.
But what'd you say? You're like, do you do a what?
I don't even remember.
Or like a facial barrier.
Facial barrier.
There you go.
Yes, there you go. So, okay, so this is also important. Let's say your patient has abfractions or recession areas. You don't want them to put the gel there. So when you're doing this barrier, you're not going to go over the recession or the abfraction area. You're going to leave that alone. Because what happens is the tray is going to be super tight on that area and gel is not going to get in there, and if it does, it will be very little.
Right.
So, and then when you're doing this, you don't want a huge blob, right? You want it to look kind of smooth and not too big.
Yeah, because sometimes when you pull out the liquid dam, you're putting in material and pull out, it's like a little something sticks.
Yeah.
But then when you cure it, it's hard. So then you make your whitening tray, it creates a hole through. And you don't want that. See, she's smoothing it out.
And I don't go interproximally too much because that's how you get sensitivity. I just do it really just on the facial.
How long do you cure each one? Or until you set?
Honestly, just like everything else, I don't really time it. I just kind of go with it and then I just touch it, and if it's set, it's set.
Yes.
This is the finished product, so I did my barriers on top and bottom. And of course, if the patient has a crown or veneer on a tooth, then you don't need to do that because they don't need to be wasting gel putting on that tooth, because obviously it's not going to change shades. So you go ahead and skip any tooth that has crowns, veneers, or even like if it's a big bonding. Like for example, this tooth here, number 8, has a composite veneer, and I just put it in here just to show you guys, but technically I didn't have to put that there. So that's just an extra info. We're gonna go ahead and start getting ready for the actual bleaching trays. And
this is our little standard machine. I don't love it because for those that are familiar with, I think the Ministar S or something like that, that's a great one.
Yeah, I mean that's a fancy one.
That's a fancy one, but it's worth nagging your boss to get it.
So we're gonna wait until that heats up. I like to have a moist paper towel next to me, just because whenever I drop the tray, I'm gonna kind of pinch around to make sure that it's tight on the model, because the worst thing to have is a bleaching tray that's not tight to your teeth and it's falling down when you have it in for 30 minutes. That's super annoying. So you want to make sure your bleaching trays are tight on the model.
That's a great idea. I mean, I always touch it with my own fingers and burn myself.
Yeah, but yeah. And then if it's wet, it doesn't stick to the material.
Yeah.
I feel like there's always the question, how far do you let it drop before you actually put it down, right?
That's a good question.
So I have this rule. You don't want to let it go too far. You don't want to let it drop too far, and then you don't want to drop it too soon.
Right.
So you just kind of have to eyeball it. Sometimes I'm literally sitting here looking, but we'll see what happens with this one.
Okay, we're ready.
there we have it. So you see how, oh, mentioning again to check out our fail pouring video. Even though we had some issues with the pouring, the whole point of that video was to show you how you can pour without having to trim, so you can do bleaching trays. So that way you see that the base of the model was not an issue that, you know, is going to prevent you from ripping this apart. That way you just save time and don't have to trim.
I do think if we can get a close-up of the lower one, maybe sometimes in the buckle areas. I'm touching your bleaching trays without my gloves.
It's okay, Carla.
This is what we're talking about. That's where the material goes. But with your trick of touching it and kind of molding it, it helps. But basically, if I were alone, I would have trimmed this because I would be scared of that.
Are you scared now though? See? Don't be scared. Just gotta try it. I mean, the worst that could happen, you have to remake it. But
true.
I am all up for not to cut corners all the time, because sometimes you should just do it right step by step. But if you can't just skip a step, why not? I think I'm ready to go ahead and start trimming these trays. Now, one tip that I will give you, make sure that you wait for it to cool down, because if it's still warm and you try to rip this, you're going to make your trays loose, and if not, deformed. So you want to make sure it's cool, and which they both are, and then you're just going to go ahead and take it off. Just like that. And you see how if it was warm, it will definitely
yeah, it will lose a little bit
it
of
will
the
loosen
shape.
a little bit. So there we go. Let me go ahead and just take this one off. Wow. I know that some people like to trim their trays kind of like scalloped, like an Invisalign retainer, which is fine. But me personally, when I do it, at least when I do it, I feel like it doesn't come out as smooth. And if it's done properly, like it's super tight on your teeth, you don't really have to do the scalloped way. And because remember, you did that barrier, right? That should prevent the gel from leaking through the tray. So what I do, I just try to trim it really closely to the teeth and make sure it's smooth all the way around, and that's that. First thing, I want to get it out of here so I don't have to be super precise.
Are you doing like a rough cut basically at first?
A rough cut at first. And okay, so I'm gonna, obviously this is my bleaching tray. So I'm missing a tooth here, and my wisdom tooth kind of shifted forward quite a bit. Obviously I'm not gonna bleach my wisdom tooth, so I'm gonna go ahead and cut it right here. Okay. Jeez, this scissor sucks.
Yeah. I would have to say, if you want to do the scalping, you need the proper scissors for that. You can't use any scissors.
I cannot work with this. Hold up. I'm back. Got new scissors. Oh my god, night and day. Okay, so I'm just going to go ahead and do a rough cut all the way around. Now I'm going to go ahead and trim very closely. As I mentioned before, you always want to make sure to try the bleaching trays in your patient's mouth to make sure it fits. So, moment of truth. Remember, we fixed the incisal of the lower tray. Let's see how it's going to fit. Oh my god.
It fits? Yay!
Okay, this is the top, and it's super tight, so that's good.
It's good.
There we go.
Perfect.
Alrighty, and that's that. And
we hope you guys found this video helpful, not only on how to fabricate custom whitening trays, but also how to troubleshoot if you have to do the trays on a bad model. So if you have any further questions, don't forget to comment below, or you can also DM us on Instagram.
You know, that's what Dental Vibes is about. I mean, of course, we would like to be perfect all the time, but let's be real, it's not possible in the dental world, especially because things can get crazy. So we hope that this video could help you not to be so hard on yourself and how to fix things if you have to. Don't forget to like our video. Of course, subscribe to our channel, hit the notification button so you don't miss any of our videos, and we'll see you next time.
Keep smiling.